Hi everyone, Dr. Nemechek here. I want to just touch on something that the parents bring up to me quite often during our visits. They may be here because they want to ask me about their child's ADHD or something like that. And at the end of our discussion, they'll mention that one of their parents had, say, Alzheimer's or Parkinson's, and is there a way to prevent that from happening? And basically, I think there is. These are inflammatory disorders. These are new. Okay, these didn't happen often before 1900 when we didn't have an inflammatory food supply and other factors. And I mean, these are triggered by inflammation and driven by inflammation. And so it seems reasonable that if you were to work on keeping your inflammation lower, that would go a long way to prevent you from getting it. And then I can say we've had maybe a dozen patients here with Alzheimer's and Parkinsons who've done dramatically well and have improved a great deal, and some Alzheimer's patients which literally fully recovered. And so it can. Now, so how do you lower inflammation? Okay. In our protocol, that's all it's about. So 2 tablespoons of olive oil every day. And this helps block from the inflammatory component in the vegetable oils, and the same toxicity as when you feed, if soybean oil and corn oil are bad for you, but if you feed livestock soybeans and corn, there's a constituent of that oil in the meat, which is also inflammatory. And the olive oil will protect you from all of that. But it's got to be good olive oil. It's got to be real olive oil. There's a lot of subpar, potentially even fraudulent olive oil in the market. So I always recommend using the COOC, California Olive Oil Council certified oils. And you can see it on the back. You can go online at COOC.com and find that. The other thing you need is a good fish oil. That doesn't mean expensive, okay? Those are two different things. A good fish oil that can penetrate the brain. So you want a high-DHA fish oil, high concentration. Fish oil has DHA and EPA. DHA is the main fraction that gets in the brain. And omega-3s and fish oil, they're the molecules that help turn off inflammation. So you need an ample amount of DHA. In fish oil, we recommend DHA 500 by Now Foods. We also recommend the Nordic brands, and then we have our Nemechek Silver brand, which is a high DHA liquid formulation. So you get both of those in, and then work on balancing your intestinal tract, the bacteria. And really, you can't do it with probiotics. Don't do that. Inulin might help some. Doesn't help so much in adults as it does in children. It's great in children. And most adults will need the gut balancing antibiotic called Rifaximin. And now, all other antibiotics don't balance your gut. Rifaximin pretty much is the only one that's been shown that can help balance your gut. And that's for most people for prevention. That's pretty much all you're going to need, actually. And that'll keep your inflammation real low. Not only will it help lower your risk of Alzheimer's and Parkinson's, it'll probably lower your risk of diabetes, cancer, heart disease, strokes, autoimmune disorders, and help a bunch of your achy joints quit aching. So it's all about inflammation, folks. Keep focused, and you'll be healthier today and a lot healthier tomorrow. Take care. Bye.